Top of the evening to you, Africa. Thank you for tuning in to Report Desk Africa. It's a beautiful Thursday evening right here in Lagos, Nigeria. My name is Blessings Mosugu, and this is the show where we take you through past experiences, the present situations, and of course, our future expectations. And permit me to welcome my co-anchor for today on his debut appearance on this sit. Over to you.
Thank you so much, Blessing. I'm super excited to be here. And of course, from wherever it is in the world you're watching us, we say a big welcome. Thank you for being a part of the show today. Yeah.
All right, so on our conversation for today's episode, we will be talking about events in the West and the Central Africa, with issues ranging from the lingering fuel crisis of fuel scarcity in Nigeria to the observation of World Aid Day every December 1st, which of course is today. So it's going to be packed full of information on these two topics. You don't want to go anywhere. This is Report Desk Africa, and we will be right back.
Welcome back. The first part of the program is focused on discussing the challenges people living with HIV and AIDS go through. Every December 1st is the day where people all over the world come together to support those who have passed away from AIDS-related illness. Now, the HIV continues to be a serious public health concern that affects millions of individuals globally. The global HIV response is at risk, and Africa is even at a higher risk. However, HIV continues to be a global health pandemic due to the number of shortcomings, including division, inequality, and contempt for human rights. News Central Adeshewa Dushoga gives us more insight on this topic.
Ayomide Adewale is a 22-year-old who has lived with HIV as a result of a mother-to-child transmission. She has learned to live with the virus in the last 16 years and has now become an advocate, creating awareness about the epidemic.
Instead of blaming someone or trying to put a blame on who and how I got infected, because it was through mother to child. Yeah, my dad was positive, and he hid it from my mom.
There are 34 million people living with HIV in the world. Out of this number, 23.8 million of them live in Africa. Although the continent has improved in its access to healthcare, recording success in the prevention to mother-to-child transmission, the lack of adequate awareness, stigma, and sexual violence against women still put the people at major risk.
Nigeria's ability to reach and sustain HIV epidemic control will be compromised if we remain silent to the real issues faced not only by key populations, but also by adolescent girls, young people, and communities that are isolated from quality healthcare services due to geography or to insecurity. This year, PEPFAR identified and initiated 6,309 HIV-positive pregnant women on ART.
As Lagos State, we're fighting to reduce stigma and discrimination, because this is one of the reasons why they isolate themselves from all the services that we render. So we're working tirelessly to continue to retrain our health workers.
Based on antiviral therapy alone, we can actually harness and end to HIV epidemics by year 2030. Because what we have at our hands today are molecules that will not allow the virus to continue to replicate, will not allow the new uninfected cells to become infected.
The United Nations had set a 2030 deadline to end AIDS in the world. With just years left, the World Health Organization raises fears that the virus is not decreasing fast enough as millions of people remain undiagnosed and untreated.
Mpox shows that infections can move quickly in sexual networks, but with community-led response and open attitudes to address stigma, transmission can be prevented and lives can be saved.
Reports have shown that young women in Africa have remained disproportionately affected by HIV. while coverage of dedicated programs for them remains too low. As the world celebrates the World AIDS Day, there is a call to address inequalities in vulnerable regions like Africa, as it holds back the progress to combat the epidemic. Adeshewa Odushoga reporting for News Central.
That was a report read out by Adeshewa Odushoga of News Central. Now, despite the 2030 goal of ending HIV, we still see that for a long time over the years, resources have shrunk, and then the progress of mitigating this HIV has really, stalled. We haven't seen much progress for a long time. And then we see dangerous and deadly statistics read out by the World Health Organization every year. And we're asking, what exactly is the way forward? Now, with these dangerous statistics, it is no wonder that the campaign is stronger now and should be even more stronger if we're going to achieve the 2030 goal of eradicating HIV totally. Now, joining us to discuss this is a health practitioner, Snorre Westgaard, all the way from India. Thank you so much, Snorre, for joining us.
Thank you for having me.
It's a pleasure. Now let's go straight to it, Snorre. We see a crazy statistic of the spread of HIV, and in Africa especially, the continent accounts for 23.8 million people living with HIV out of the 34 million people in the world. So why do you think that this virus is so prevalent in Africa?
Yeah, I think you can find the answer to that in the theme of this year's World AIDS Day, which is Equalize. And Equalize highlights the necessity to fight inequalities and to provide resources to the areas that are underserved. Because the main reason why the AIDS epidemic is continuing is because of inequalities. And to the question you asked, the reason why a big proportion of the people living with HIV is in Africa is because of poverty. It's because of lack of health resources, and poverty leads to lack of information and so on. So we really need to see more focus on information and resources reaching the people in underserved communities. That's how we can turn the tide.
All right. I would like to, of course, also ask, do you think that there is enough awareness about the prevention of HIV and AIDS in Africa, particularly in recent times? It looks like the level of awareness, the level of campaigns seem to have dropped. Do you think in modern times, in recent times, do you think that the level of awareness is on?
Unfortunately, no. I mean, there's still a lot of need for more awareness, for more information. And I also think what needs to be done, or what our experiences is, because we go door to door and work with communities to reach communities in hard to reach areas, is that information is not enough, but counseling and mobilization is also necessary. So if you look at the figures, then today globally, around 75% of the people living with HIV know their status. And that means that 25% do not know they are living with HIV. And one of the very important strategies to end HIV by 2030 is to ensure that all the people, or at least over 95% of the people living with HIV are on antiretroviral treatment. So this demands more information to the people, so they get tested and they access treatment. And then, of course, we can also see that this year, for example, another 1.5 million of new infections have been added. That's also globally, 860,000 of them in Africa. And that also shows us that continuous community mobilization and information and awareness is necessary to avoid these new infections.
All right, Snorre, with the influx of antiretroviral drugs, it has become much easier to manage, still talking about HIV. And now people know now that having HIV is no longer a death sentence. There are excellent treatment and prevention measures out there to tackle HIV. But 11.7 million people still do not receive antiretroviral therapy. The drug treatment strategy for HIV patients I mean, does this have anything to do with the cost of these drugs? Why is it that people still don't have access to antiretroviral drugs, despite the fact that the awareness is everywhere? Is it that we need to call for a subsidy for these drugs, especially for the people who live below the poverty line?
I think, when it comes to accessibility to drugs, so making the antiretroviral drugs available for people living with HIV, I think this is one of the success stories in fighting epidemics. And when we talk about equalizing, then you can say the fight in the early years, in the end of the 1990s and the early 2000s, where activists, communities, and then put a lot of pressure on the international communities and governments and pharmaceutical companies to make these antiretroviral drugs available at a reasonable price. So that has been done, and the international community has come together with governments to find ways to finance the much reduced cost of the drugs. But still, it is not enough to have drugs available. Then you also need health services and support to people to get access to the drugs and to stay on the treatment. I think also there are examples where people, they get off the treatment and they need help to come back again. People who maybe be tested and know they're HIV, but they do not seek treatment because of the stigma, and mainly because of the stigma. So we have to fight stigma. We have to mobilize communities to support people living with HIV. We have to create systems in the communities so that people can be supported to adhere to the treatment so that it's effective. So so I don't think the answer is really subsidized prices, but the answer is definitely to invest more resources in health services and community mobilization.
All right, I just want to pick you on something you said. You talked about stigma. What do you think has been done to ensure that stigma is actually, addressed? Because in Africa, for instance, once someone is known to be HIV or AIDS positive, there's a kind of social distance. The person is, immediately given. So what has been done to make people aware that, look, even though HIV and AIDS is serious, you don't have to sort of stigmatize at such individuals? What has been done?
Yeah, I think your report gave a very good example. The young lady who had been born with HIV 22 years ago, she you see an example of a young woman that looks healthy, who has survived and will live a productive and meaningful life despite being HIV positive. I think these kind of images, these kind of people who stand forward and becomes activists and advocates, they are very, very important. I also think it's very important to work with communities to provide information and counseling, not only to people who are infected by HIV, but also people who are affected. Because we can see, family support, community support is very, very important also to break down the stigma. So community interventions, and also, to give a platform to people living with HIV who can stand forward and show their example and tell their stories is very, very important.
All right, Snorre, I would like for us to focus a little bit on the theme for this year's World AIDS Day, which is Equalize. It says putting ourselves to the test and achieving equity to tackle HIV. Now, based on that, I would like for us to look at the disparity between the male and female, especially in Africa. Now, women are said to be more prone to getting HIV, and based on a recent report, a 2022 report, and the HIV response program, it actually says that women have more HIV than men in Africa. But then it seems like women have less access to these treatments and antiretroviral drugs. Why exactly is that?
Well, I think when the theme of equalize, and of course the first thing mentioned when you talk about equalizer is also to equalize the rights of women and men, and we have seen examples, and I think there's enough research done and studies done who shows exactly what you are saying, that actually more women are living with HIV, and also they have difficulties in accessing treatment. So I think this have to be addressed through targeted programs that you actually target women, young girls, pregnant women, to avoid transmission of mother-to-child transmission of HIV, and women in general, so that they can be mobilized to you can say stay together, to mobilize them to work together as a community and help each other and support each other, and also actually look at specific health services that are targeted to women and girls.
Right. Quickly, the 21st century saw the advent of quite a number of pandemics. So we saw the COVID-19, we saw the Ebola. The world is still grappling with all of that. Do you think that focus on this, what I call them now, new pandemics, has sort of shifted their attention from the focus on HIV and AIDS in Africa?
Yes, unfortunately, that has happened for sure, and because the pandemic is global, it affected also the rich countries. So in that way, a lot of resources was invested and put into addressing the COVID-19 pandemic in the whole globally, and also in the rich countries. And we saw I think there we saw an example, where these inequalities was very stark, because the people of USA and Europe were vaccinated much earlier and much faster than people in Southern Africa, for example, or Sub-Saharan Africa. So it's a very stark example on inequalities in health services, nothing to be proud about. And as I said, in contrary to actually the enormous effort that was made in the beginning of 2000, after a lot of pressure on creating, to reducing the prices of the costs and providing the technology to produce also locally in some countries the ARV treatments. But what we can see generally is that both the pandemics, especially the COVID-19 pandemic, and also the war in Ukraine, is taking resources away from the general development work and development aid. But then especially also HIV/AIDS, some of the focus has gone away from HIV/AIDS, and also some of the resources. And this is very worrying, because of course we would like to achieve the goal of to do away with HIV/AIDS to finish HIV/AIDS by 2030, and as it is now, this is going off track. So we need to get back on track towards that goal. That should be the main focus.
All right, Snorre, if you'd permit me, I'll still like for us to, talking about getting back on track, I'll still like for us to talk about the theme for this year's World AIDS Day. And I would like to read out the statistics that was presented by the World Health Organization and read out by the Director General Tedros Ghebreyesus. Now, he says that about 38 million people live with HIV. And as at 2 years ago, 1.5 million people were newly infected, and 680,000 people died from related causes. Now, narrowing it down to the children, now there are 2.1 million children living with HIV and AIDS around the world, where alarmingly 2 in 5 children live with HIV worldwide, and they do not know their status. Now, we in the reports we saw that a 16-year-old young girl grew up living with HIV because of the mother-to-child transmission. How exactly are we supposed to? I mean, it seems like we're making awareness, but it's not enough, because so many people feel that HIV is just by transmission. When you have sexual intercourse, or by blood or sperm or whatever, but we don't exactly talk about the mother-to-child transmission, and that is one thing that is killing the children. So how exactly do we widen our scope when we're talking about creating awareness for the children?
Yeah, I think that's actually a very unfortunate situation and unacceptable, the statistic that you mentioned about children. Because it's true, there are a lot of children that go undetected and untreated. And it is simply not necessary because we have the tools, we have the technology, we have the resources to prevent transmission of HIV from mother to child. It doesn't have to happen. It can be prevented. So when it doesn't happen, it is because the women at risk of being HIV positive or who are HIV positive, they are not included in this treatment in time to prevent that their children are infected. That is number one. Then number two, when it has happened, because you mentioned these children, they are already infected. So when it has happened, then, you know, they need to be detected. So within the strategy of 95, 95, 95, which is the UN strategy of 95% of people living with HIV being tested and knowing their status, so, and then 95% of those people actually getting access and to antiretroviral treatment, and then 95% of those who access the treatment, they get undetectable viral loads. I mean, their viral loads goes down. So, and by that, they are no longer infectious. So within that, we need to detect, I mean, we need to mobilize everybody who has been at risk ever for being infected with HIV to be tested. And for example, mothers who then test positive and have newly born children, the children should be tested so that we can detect those children who are HIV positive and provide antiretroviral treatment to them. So this demands, you know, concerted efforts. It demands strategies where you actually identify the people who are at risk of HIV, identify the children who have been born by, you can say, parents who are at risk of HIV. Sometimes we already know that, you know, they have the information in the clinics, in the test centers that people are HIV positive, and if they have children, then these families should be sought out and visited and then mobilized so that their children can be tested, because that's the only way that you can get children on treatment is that you test them.
All right.
So much more has to be done here. And I think in the speech by the UN Executive Director, she also said that a new global coalition has been formed to address this issue, specifically to address children.
All right, thank you so much, Snorre Westgaard, health practitioner all the way from India. We really appreciate your time with us right here on the show.
Thank you so much for having me.
Well, I mean, we know, Dapo, that HIV has been a prevalent issue for the longest time. And then COVID-19 didn't make it any better because when it came, those who had HIV were more prone to this virus. But we're happy that the antiretroviral drugs are now making things better. But we still need more people to be aware.
Yeah, now talking about awareness, it looks like, particularly in modern times, recent times, let me use that word, it looks like that the attention that we used to get while we're still younger concerning AIDS seem to have faded away. So some people don't even know that outside sex alone, you can contract AIDS.
True.
From not having your personal effects like your clipper. You go to the barber shop, for instance, there's the general clipper, right? But ideally, you should have yours.
True.
Some barbers don't even know they're meant to properly sterilize their clipper before they use it on the net. I mean, little things as small as that, you know. So I think we need to go back to the basics in terms of level of awareness, right? It starts from schools, starts from social gatherings, even, clubs. Yeah, clubs where people hang out, you know, level of awareness there that, look, the figures now is seriously alarming. I was seeing something yesterday. Nigeria alone, for instance, is almost having almost over 1 million, if not more. And that's the people that went, you know, for testing. Not people that, by God's grace, it will never be me.
And then it's possible so many more are not
exactly,
even aware.
So many more are not even aware. So I think right now the level of awareness really needs to really spike. I see around some pharmacies and stores and malls that have something as little as spittle in case you want to, test yourself. So people should just take advantage of all of these opportunities.
Very true. Well, HIV does not have a cure, but trust me, with awareness and proper treatment and early detection, it can be managed. We're going on a short break now. This is the Report Desk Africa. When we come back, we'll give you another story. Stay with us.
News Central TV, Africa's #1 storyteller, has come with the best of both worlds. With a combination of news app and live TV, we ensure that you keep track of the latest headlines, breaking news, and in-depth analysis from professional journalists from around the continent. Download the News Central TV app on Android and iOS and get started today. Don't forget to follow us on News Central's social media platforms. News Central, Africa First.
Welcome back. It's still Report Desk Africa, and of course we are looking at prevailing issues across the continent. We initially talked about the AIDS prevalence in Africa, of course celebrating today, which happens to be the World AIDS Day. But right now, the second half of the show, we want to look at something lingering in Nigeria in particular. For the past 2 weeks now, there's been a shortage in fuel. If you, of course, go around, you would see filling stations all filled up. But we want to get reactions of Nigerians before we dig deep into this particular story. We'll be going to Shewa right now, Udushoga, who is on standby. Of course, Shewa, good evening. How are you?
Hello, Dapo. Good evening.
Good evening, Shewa.
Yeah.
Good evening, blessed.
Okay, so what's it like on social media concerning the fuel scarcity situation? What are Nigerians saying?
All right, as much as we have long queues on the streets of Lagos and across every other state in Nigeria, we also have agitations on the social media space. And then we go right to Twitter, where we have @1John1 says, use your ACO. AC no they consume fuel, no they you use fuel scarcity as excuse to punish yourself under this heat. Enjoy the luxury of your AC. The load on the engine when the compressor picks up doesn't consume much fuel. It depends on how you accelerate. Enjoy your back. So this person is trying to react to, the general notion that when your AC is on, it consumes more fuel. And we see a lot of Nigerians wind down their glasses as the fuel scarcity in the country bites harder. Let's see the next tweet. At Explaining Fina says, I need power bank in my life. I rely on Jen too much, and now there is scarcity of fuel, with an emoji crying, and he said, God, I beg. And we see a lot of people now trying. I know we have the power situation in the country isn't very friendly, and then now while people rely on the generator set to fill the generator has become a problem. Let's see the next tweet. It says at FineBoyDami_ says, fuel scarcity at the end of the year has become a culture in my country. Now this is particularly a culture in the Nigerian system, but in the last 2 years, we've not been able to see this trend, but now it looks like it's back. So the next tweet says at Apricot Doctor, said this fuel scarcity is becoming embarrassing, really. Well, of course, we see a lot of queues. And then another one said there at Mr. Boboski says, dear M. Buhari, that is referring to the president of Nigeria. He says this fuel scarcity has become a major issue in the country. It's scarce and expensive. Please do something. So that's it from the world and the streets of Twitter reacting to the lingering fuel scarcity in Nigeria. It's back to you, Blessings and Dapo.
Thank you so much, Adeshewa. I mean, from the first two tweets, you see that Africans really have a way of making light of every situation. It really is embarrassing, like Apricot Doctor said, and hopefully there is a solution to it very soon. But right now, we go on a short break, and we'll be right back to talk about the lingering fuel scarcity in Nigeria. Stay tuned.
News Central TV, Africa's #1 storyteller, has come with the best of both worlds. With a combination of news app and live TV, we ensure that you keep track of the latest headlines, breaking news, and in-depth analysis from professional journalists from around the continent. Download the News Central TV app on Android and iOS and get started today. Don't forget to follow us on News Central's social media platforms. News Central, Africa First.
Many thanks for staying with us. It's still Report Desk Africa right here on News Central Television. Now let's go to the western part of the continent, What Nigerians initially thought was a fleeting frenzy has now begun to drag for too long. And now there is even a threat of a much more steeper price hike if care is not taken. And we're talking about the premium motor spirit. Now, for a while now, commuters in Lagos, Nigeria are still having tough times as a result of the shortage of petrol. Many petrol stations are deserted, while long queues have become a normal sight at the few petrol stations dispensing the premium motor spirit. Now, my co-anchor here earlier packaged a report, Dapo Adegboye, which sheds more light on the current situation in the country. Do take a look.
Some Lagos roads characterized by traffic gridlock are having a free flow today. The reason may not be far-fetched. Many vehicles spend hours without end at petrol stations with the hope of getting the product. The long wait and the likelihood of not even buying after hours on the queue wasn't the frustration for the motorist.
The queue is getting worse and worse every day. People are really suffering, passing through difficulties and getting this fuel, and I don't know the problem. We are an oil-producing nation. Why is all this thing happening? Is it because of bad governance or what? We don't know the problem.
It's been hectic finding fuel since morning. I left home like around 6 o'clock, and I've been going about from one filling station to another. I live at Awoyaya. After queuing for a long time, I will end up living there. So I thought I'll be able to get fuel here. That's why I'm here now. So since 6 o'clock, I've been looking for fuel.
Honestly, it's very, very bad. It's very, very bad because I've been here since morning, since 6 a.m. I queue up for fuel here. And the worst part is they say fuel has finished. And as you can see, they are selling people in the cake. We are just queue up here, some even left. So the whole thing is just stressful for everybody. So I'm just tired of everything.
Some of the filling stations sell between 169 naira to 230 naira per litre. Left with no choice, some of these motorists opt for the black market option, which is pretty pricey.
4,000. The fuel is very scarce, and no fuel for some filling station. But the filling station where you go see fuel, there is a queue plenty, and there's some filling station don't have fuel. The one we get queue too plenty. At least before you get this one, no be small thing we do. And there's some they sell them in the night. Because no be only me they buy them, people they buy them, all those vehicles we keep, themselves they buy them.
With persistent long queues at the filling stations across Nigeria and no official statement yet from the federal government, many frustrated Nigerians are left to wonder how long this would continue and when the fuel scarcity situation will come to an end. Dapo Adegboye, reporting for News Central Television.
Joining us to, of course, shed more light on this is News Central business editor Nasser Agbalaya. Nasser, thank you for your time.
Thank you for having me, guys.
Thank you for joining.
All right, so let's get to it. This is about the fourth time Nigerians are experiencing fuel scarcity this year. What exactly is the reason for this prolonged shortage?
Well, as we all know, the first reason is the fact that Nigeria is not refining any of its crude oil. Crude oil is taken from Nigeria and exported out, and now we import the refined product. Now, the initial scarcity at the beginning of the year was because of the Russia-Ukraine war. Now, as that subsided because of some peace deal, some relative peace deal there, now another problem crept up. Just last week on Business Edge, that's our business show on News Central. Now, we interviewed the PRO of IPMAN, that's the Independent Petroleum Marketers of Nigeria. And he told us categorically that the very large container that bring fuel, that import fuel into Nigeria, had breaked as of last week Thursday. But there was a small issue around those ships that would now bring them onto the shores, onto the depots. They had some disagreements about the cost at which those would ferry the product onto our shores. Now, as that was ongoing and that they were still having the price, now the depot owners also hiked the amount which the fuel stations get the products. Now, all these are some of the reasons why commuters, Nigerians, are not getting the products.
I would also like to ask, now we've seen that some filling stations are selling at very exorbitant prices. We're talking about from 320 naira per litre to even 500 naira per litre. And the Ipman, like you said, during the interview also said that one of the major reasons why there is a price or fuel price hike is because of the private depots. We don't know how true that is. But my question is, why this difference in prices? I mean, some people are not even selling at all. Some are selling so high, some are selling at average price. So why exactly are there difference in pump prices?
Well, sometime this year, I believe around June, the federal government started implementing the 0.05% tax on marketers. Now, this tax, although will be paid at the end of every fiscal year, but now the depot owners have added this to their cost. So invariably, the cost of which they sell the product to the fuel station has gone up. Some are selling it at 165, some are selling it at 180, and some at 190. So depending on which depot the fuel stations get it from, that will determine how much they sell it. Let's not forget, it's a business and they are out to make a profit. So the price is now much a variance than before. Although even before, when it was sold at 145 to them, now the cost of moving this fuel from the depot to say states that are further up north or further east or down south. Now, the longer the distance, the higher the selling price of the product. This has been on for a while. And the basic reason is because the NNPC, now NNPCCL, they do not have depots that are dispensing fuel. They are relying on private marketers' depot. Now, with this, those would basically sell at whatever price which they buy it. And of course, that will jack up the selling price at the pumps.
Now, it's almost a week since the fuel scarcity started. And of course, till now, there hasn't been any official statement from the government. Any idea why this hasn't been, why this, of course, is at the moment?
Well, we all know that it's 2022. Next year, Nigerians are going to the polls. So literally at this point in time where political parties are campaigning, most politicians are literally just out there canvassing for votes. Now, with this happening, those who should be monitoring what is happening also are sort of aligning themselves with one candidate or the other. So the oversight that they should be doing is not happening. Literally, government is at a slow pause and in a degree of autopilot. It is a normal thing that happened towards the election. It's a real surprise that the president actually went with the NFC's GMD, Mele Kyari, to unveil the first oil drill in the north. Normally, such things are left to the next government. But some things are happening, but just not as effective as it should be. Because by now, at this time, we expected that the federal government, at least through the agency in charge, would have said, oh, this is the reason why there is scarcity. But they're not doing that because they are more concerned with the next government that will be in place come 2023.
All right, Nasir, I'll just like to ask you this last question finally. How true is it that oil marketers are now free to sell fuel or premium motor spirit as we know it at any price? Because the federal government is still talking about the federal government and the NNPC keeping mum now. The federal government no longer regulates the prices so they can sell at any price. We just want to know how true that is.
It is factual. Now, the Minister of Finance had informed us sometime this year, particularly after the Q1 budget. So the Q1 review of the government's expenses was announced. Now, she said that they have entirely removed subsidy for power supply. And she also mentioned that the gradual removal of subsidy on fuel will happen. We are experiencing that gradual removal. Right now, they are just literally testing the waters. It is expected that the next government that will come, that will be voted in come February next year, will entirely deregulate the sector. So this silence also can be akin to that they are looking at watching the market as how much they are selling it. We all know that, as I mentioned earlier, that the 0.05% tax is being implemented. So with that, the marketers already have added more to the price. So as Nigerians bear it gradually, it is expected that the actual selling price could end up to be like 300 to 400.
All right.
Even up to 500, depending on where it is being sold, either in the urban areas or in the rural areas.
All right, Nasir, we might just have to cut in here. Thank you so much for your time.
Thank you, Nasir.
Thank you for having me.
All right, up next, we need to look into the crystal ball to tell you the forecast for the coming week. Stay with us.
Hello, welcome to the forecast segment on Report Desk Africa. And then we start off from South Africa, where the independent panel probing whether President Cyril Ramaphosa of South Africa has a case to answer for the theft of foreign currency from his falafala farm in 2020 has handed over their report to the National Assembly. Now, according to the report, the panel have concluded that President Cyril Ramaphosa may have violated the Constitution or the law and committed serious misconduct. And then from there, we go straight to Namibia, where the ruling party elected Deputy Prime Minister Netumbo Nandi Ndaitwah as its vice president, making her the frontrunner to lead the party into the presidential and national elections in 2024. SWAPO has led Namibia since independence and remains the country's biggest political party. And now from Namibia, we go straight to Malawi, where the Ministry of Health say that it has cut malaria deaths by 50%, from 23 deaths per 100,000 population in 2016 to 12 deaths per 100,000 in 2021. Now, the exercise will be implemented in 11 districts, targeting 330,000 under 5 children. Now, the WHO recommended that the wide vaccination against malaria in African countries after a successful pilot phase in Malawi, Ghana, and Kenya. Well, that's all on the forecast segment. Dapo and blessings, I'm handing over to you.
Thank you so much, Shawa. Really interesting case in South Africa with the Palapala Farm Ramaphosa saga. And it quite is baffling to know that Ramaphosa has declined to even comment on the situation. But that doesn't change the fact that whatever the independent probe comes up with is what he's going to have to face. And, you know, they have said it time and time again that he's willing to step down if at all he's found guilty. So we just look forward to seeing how that turns out.
I mean, to a very large extent, one can say that the judicial system in South Africa, particularly for corruption, is pretty, you'd want to say, a bit robust. I mean, looking at the former president who went to jail for allegations, it simply tells you that in South Africa, probably to a large extent, no one is above the law. I
mean, you have a certain control of the country when you can have people in power answer for their crimes, and we love to see that.
Yeah.
Thank you so much, Showa.
Thank you, blessings.
Well, it's been an insightful episode of Report Desk Africa. How do you feel?
Yeah, but of course, I'm happy and super excited as always. I mean, today in particular, pretty informative. The HIV and AIDS, the prevalence across Africa, the need to start, campaigning right now, letting people know that this thing is real. Right. I mean, the statistics now is super alarming. A lot of, I call it woke young people are not even paying attention.
They're not
to
working
this,
off.
You know? So,
they're not working off.
I think it's really biting.
Yeah, and you know, talking about the fuel scarcity, I know this is going to affect the Christmas and New Year celebrations, but hopefully, fingers crossed, a solution is brought forth very quickly. Yes. Well, it's been a very beautiful episode of Report Desk Africa. My name is Blessings Mosugu.
And I am Dapo Adegboye.
Have a lovely rest of your week.